As we get older, it is not uncommon for us to experience grief and isolation. Sometimes these are normal feelings that are just a part of life, but they can also be a sign of depression, which is not normal. The good news is that this is a preventable and treatable condition. Depression is caused by a combination of factors including genes, personal history, brain chemistry, and stressful events like the loss of loved ones, making the transition from work to retirement, and dealing with serious illnesses. A family history of depression also increases a person's risk of developing depression themselves. During the COVID-19 pandemic, physical isolation from loved ones has become more common. The pandemic has caused a great deal of emotional, physical, and psychological stress, which has resulted in 1 in 4 adults reporting anxiety and depression during these times. Depression in seniors can present differently than it does in patients of other age groups. For some adults, sadness is not the main symptoms. You may have less obvious symptoms or may not be willing to talk about your feelings, which can make it more difficult to diagnose depression. Sometimes older people who are depressed feel more tired than normal, have trouble sleeping, decreased energy or fatigue, thoughts of death or suicide, or may seem irritable. Depression can often be mistaken for dementia or other similar cognitive health problems in older adults. One key difference is that dementia patients often feel frustration, while depressed patients withdraw from the outside world. If you've been feeling less pleasure in activities that you typically enjoy, or are feeling down or hopeless, we recommend that you talk to your physician. These feelings may be new to you because COVID-19 has forced you to isolate yourself from your community. Your physician can give you a longer questionnaire called the Geriatric Depression Scale to evaluate your symptoms. Treating depression in older adults is critical, not just for your mental health, but because depression can also affect your ability to comply with treatment plans for other health conditions. Depression can also exacerbate symptoms of other chronic conditions that you may have, such as hypertension, diabetes, and Parkinson's disease. There is no need to be alarmed, because there can be other explanations for changes in mood. For example, changes in vitamin levels or thyroid problems can also lead to symptoms similar to that of depression or dementia, so be sure to consult your doctor. There are many proactive steps you or your loved ones can take to prevent and alleviate depression. Studies show that increasing activity can help improve mental health in older adults. It has been observed that patients have fewer depressive symptoms with more frequent physical activity. Activity does not just mean exercise. Anything that engages your mind and body can be considered an enrichment activity. Some examples include walking, social activities with friends, or gardening. Gardening has been shown to reduce anxiety and stress levels while increasing overall emotional well-being and physical fitness. One study showed that just viewing plants reduced stress, fear, anger, and sadness, as well as reducing blood pressure, pulse rate, and muscle tension in study participants. When participating in social activities, make sure to wear a mask and social distance as much as possible. Looking after one's mental health is a key component in maintaining physical wellness and enjoying what life has to offer. If anyone in your life is experiencing symptoms of depression, encourage them to seek medical care as soon as possible.